And we will start with the first topic on surface ablation, why resurgence, by Dr. Surabhi Priyadarshini.
Thank you, ma'am. Very good morning to all of you. So our instruction course is all about the surface ablations. So my topic is why resurgence of surface ablations. It's okay? Yeah. Among all the surface ablation procedures, PRK and trans-PRK are the most widely used procedures lately. These procedures being no touch, no flap, no blade and only laser procedures are gaining a lot of popularity these days. For last 2 decades, LASIK was the mainstream laser corneal refractive surgery. It provided clear vision from day one only. There was no pain or discomfort noticed and there was no risk of haze. Talking about downsides of LASIK, it reduced biomechanical strength of cornea and of course the flap created complications were noted. It was not possible in thinner corneas and it was not possible in persons prone to injuries. PRK was a 2 decades old concept. Earlier it was used to treat the complicated LASIK flaps only, and its main disrepute was due to pain and haze. But then it has recently emerged as mainstream refractive surgery. Talking about PRK, it involves manual removal of epithelium and thus irregular margin created causes pain, discomfort, slow healing and thus haze. Trans-PRK resolved this dispute by using laser beam as a mean to remove the epithelium and to ablate the stroma as well. So the smooth margins led to faster healing, faster visual recovery, lesser pain and ease of use in just a single step. If we talk about advantages of surface ablation over other laser refractive surgeries, studies have shown that the risk of ectasia post-operative, post-trans-PRK is very less. It's almost rare. And while its counterpart surgeries like LASIK have shown 0.04% to 0.6% incidence of the same. Talking about the post-operative dryness, in trans-PRK procedures, only terminal nerve fibers are being involved and thus faster regeneration and thus not so much dryness is reported. No flap is created, thus no flap related complications. Apart from being touchless, bladeless procedure, it can be used in borderline cases also, that is the thinner corneas, and there is no vacuum related stress on the retina, can be planned for contact sports persons as well. It is very much indicated in the patients having anterior basement membrane dystrophy and recurrent corneal erosions. Those patients who are not eligible for LASIK, such as those having flat cornea, steeper cornea, those involved in sports, contact sports, those having deep set eyes, trans-PRK is the only rescue. It is being used as, along with the collagen cross-linking, and the procedure is known as CXL+. It's also being used as a re-enhancement surgery after LASIK. Now I will be discussing with you all few case scenarios in which we had to plan a refractive surgery and we found trans-PRK procedure as the most apt procedure. Like this was a male patient with astigmatism, with irregular astigmatism and signs of forme fruste on repeated pentagram scans. His pachymetry was stable in the range of 507 and 509 microns. He had higher order aberrations with more of the coma aberrations and irregular epithelial mapping. So we planned a customized trans-PRK procedure for this patient and the results were great with stable repeated pentagram scans. Another case was of this patient with high myopia and very below average corneal thickness and a low AC depth. So ICL surgery was not an option, LASIK was out of question, so trans-PRK came as a rescue in this case too. This was the third case in which this patient had a good pachymetry, but the person was involved in defense services. He was selected in defense services and was an active basketball player. So trans-PRK was the best option for him as well. This was a case scenario in which the patient has low myopia, but he had a deep set eyes with average pachymetry and flatter cornea. So we planned a trans-PRK procedure for him as well. Studies have shown that trans-PRK procedures, pain duration was just 1.5 days, and on a scale of 0 to 10, mean pain intensity was around 3.74, which is very good. If we manage pain and the haze properly after trans-PRK procedure, it is really giving promising results to us. Management of pain and haze will be discussed in detail by Dr. Elia and Dr. Anisha. Thank you for your kind attention.